Hi, I'm Christian Brindle, and welcome to the Everything Medicare Podcast.
What's up, everybody? This is Christian Brindle. Welcome back to another episode of the Everything Medicare Podcast. I'm your host, and this is episode 281 of the number one Medicare podcast in the country today. We are going to talk about, as we rage through the annual election period, the Medicare annual election period, about Medicare Advantage. We're going to be talking about providers and their limited knowledge of insurance. Okay. Now, before I jump into the nitty-gritty details of this podcast episode today, I want to first start off by mentioning that I am not trying to crap all over providers in this episode. It might seem like it as I'm going, but it's not a blanket statement, and there are certainly good people that are providers, work in doctors' offices, billing offices, and are overall, healthcare workers in our country that maybe either have more knowledge or have, an understanding, a clear understanding of their limitations about what they know. In our office, we work with thousands of different folks on their Medicare health plans on a day-to-day basis. We work with people that are on original Medicare with a Medicare supplemental plan. We work with people that have TRICARE for Life. We work with people that have Medicare Advantage plans. And we work with people all over the country in over 40 states. I've been doing this for roughly about 10 to 11 years now. I've spent my entire adult life working with people on their Medicare health plans. And one thing I can tell you with absolute certainty is 9 out of 10 providers and provider offices do not know much of anything about insurance. Now, when I say that to people, people are shocked by that. They're absolutely shocked by that. They think, well, they're my doctor's office. They probably know everything. They are to be listened to and trusted in most cases, in my opinion, when it comes to your health, what you should be taking prescription-wise, what kind of changes you should be making to your lifestyle, whether you need a surgery, whether you don't need a surgery, when it comes to medical advice. Where you don't want to listen to them is when it comes to insurance advice. And I'm going to kind of jump into the various different circumstances that I'm referencing throughout this episode, okay? If someone came to me, my organization, an insurance agency, one of the top Medicare brokerages in the country, and asked for medical advice, we would turn them away and say, we're not medical providers, we're not licensed doctors or anything of the kind, and you should consult your doctor. Every time, because it's not our field of expertise. Doctors' offices should, in my opinion, be doing the same, and the fact that they're not licensed insurance representatives, they know very little about the plans that they give advice on. They should be, in my opinion, fined by the United States government for giving false information and false advice about insurance products. Why am I bringing this up? There's two paths I want to kind of travel down on this pathway, right? The first one is from our own experience about dealing with doctors and providers in our office. Now, there are some doctors and providers in our office that we absolutely love. We work closely with, and they're, great partners for us. So it's not a blanket statement, but there are way too many providers out there that try to paint the narrative that you should be on original Medicare and only original Medicare. Never a mention of a Medicare supplement plan. Never a mention of the tremendous difficulties and lack of coverage and holes that come associated with just having original Medicare. They just say you should be on original Medicare. No other context, nothing else other than that. You shouldn't be on a Medicare Advantage plan. Why is this? Let's dissect this a little bit. Medicare Advantage plans typically do have some prior authorizations, some extra restrictions that the doctor's offices need to submit in form of documentation in order to get claims approved. Medicare doesn't require these same things because Medicare doesn't have enough staffing to kind of go through and kind of police these kind of things. That is typically the way it goes. Insurance companies, and by the way, any type of insurance company plan asks for prior authorizations and things along those lines to approve things to make sure they are what? Medically necessary. Now, I'm not jumping on here today to kind of try to paint the picture that there's never been a situation where a Med Advantage plan turned something down and just played hardball that they shouldn't have. Certainly that's not the case, but I would be going as far as to say is in my office with the thousands of clients that we work with, we deal with claim issues every single day almost. We have claim issues come into our office every single day that we help straighten out for the client. What do claim issues look like? Well, claim issues, simply put, are a bill to the provider, a bill from the provider that is being billed to the person on Medicare that they shouldn't have to pay, right? And it comes in a lot of different forms. It could be a billing mistake. It could be a coding error. It could be a lot of different things. It could be that the bill was sent out before the insurance has had a chance to pay for it. All of these things are incredibly common. And if I had to guess, 9 out of the 10 claim issues that we see come across our desk that we actually get involved with, we talk to the insurance companies, we talk to the providers, and we try to kind of work something out to kind of make sure that it gets resolved, is in fact, and I mean this when I say 9 out of 10 could be resolved by the provider's billing office if they had a better working understanding of the insurance and if they would pick up the phone and call the insurance company. Now, not all the time, but 9 times out of 10. 9 out of 10. What are the most common things we see? Well, in my opinion, there's 3. 1, there was a wrong billing code used. Happens all the time, actually. I had someone come into my office just the other day, a client of ours, said that he didn't like his insurance. I asked why. He had a Medicare Advantage plan. He went to his dentist. He tried to get a crown done. Covered service by the plan. Covered at 100%. He had not reached his maximum payout limit. So what's the problem? Sounds like the big bad insurance company was trying not to pay, right? When we really dug into the actual situation, the dentist's office's billing department used a code for an implant, a non-covered service on this particular plan. So he went in for a crown, got a crown done. Nothing to do with an implant. They used a billing code for an implant. Honest mistake, I'm sure. But what does the provider's office do after the fact? Well, they blame the insurance company. They never called the insurance company. They never investigated it to see why it wasn't covered. They never did anything to go above and beyond to try to help get this fixed for the patient. Their jobs, by the way. So this person has this apparent understanding that the insurance company's bad, they don't cover anything, when in reality, it was a wrong billing code. Understand this, folks. When it comes to any type of insurance, they are not in the room with you when you get something done. They are solely relying on what information they get sent over to them by the provider, and they know nothing more. So if the provider sends them a code or information that says they did something that they didn't, and maybe it's a non-covered service, they have to go by that. Is that the insurance company's fault? Wrong billing code, number 1. Number 2, the insurance company comes back. Very common, by the way. We see this with group plans. We see this with under 65 ACA marketplace plans. We see this with Medicare Advantage plans. They try to get something approved. Maybe it's a surgery, something like that. The insurance company comes back and says, can you please submit documentation XYZ showing this is medically necessary for the patient or what your diagnosis is? They ask for a little bit more information. What ends up happening? The provider never responds. Happens a lot, actually. Never get a response. Radio silence. So then what ends up happening? Well, the claim gets denied. Big bad insurance company, right? except for not. The billing department could have responded. These are situations that come into our office all the time. What we end up doing, anybody could do to fix it, by the way. We call the insurance company. We find out what the insurance company is missing. We find out when they made contact with the provider asking for it and never got it back. We call the provider, tell them what they need, tell them where to send it. They send it, boom. Rebuild, covered, problem solved. The third one is, this happens a lot with ambulances for some reason. They don't bill the insurance at all. They either don't bill the insurance at all, or their automated system of a hospital or a clinic or something like that sends a bill out before the insurance has had even a chance to pay. In those circumstances, we had one come the other day. This happened with original Medicare, by the way, and a Medicare supplement. Original Medicare and a Medicare supplement. This happens all the time, actually, believe it or not. You think there's no claim issues if you have original Medicare? Think again. Because the problem lies with our healthcare system and providers and their lack of understanding of insurance and billing and their lack of follow-through, doing their jobs. I had a situation the other day, as I was mentioning. Medicare supplement client goes to the emergency room, gets a $1,000 bill in the mail. He has full coverage on his plan. Full. He's panicking, freaking out, being like, why do I have a $1,000 bill? We call and look into it. They had sent out the bill before the insurance had had even a chance to pay. And it came through and paid while it was in the mail on its way to him. And he really had a $0 balance. Could cause someone a heart attack, potentially, thinking they owe a couple grand when they don't. But that is the nature of providers. Other times, they just don't bill the insurance at all. They don't have any insurance information on file. They never ask for it. Ambulance companies do this all the time. So they're billing full. Happens whether you have original Medicare, happens whether you have Medicare Advantage. And so because of this, 9 times out of 10, this being an issue, it paints a negative light for Medicare Advantage plans oftentimes. And you get people that don't know anything about insurance criticizing the plan. I see healthcare providers online all the time. I see them tell our clients all the time, you should just be on original Medicare. Not mentioning that they have an unlimited 20% out of pocket, unlimited 20% out of pocket for medical bills. They have a Part A deductible north of $1,500 a year. They have a Part B deductible, $240 a year, followed by an unlimited 20% out of pocket. You don't have any prescription drug coverage, which you get penalized for not having. You don't have any dental, vision, or hearing. So you have 80% coverage with an unlimited 20% out of pocket and only medical coverage. No prescription drug coverage, no dental, vision, hearing. Why do the providers point you in that direction? Because it's easier for them. They have less work to do. They don't want to do their job, oftentimes. People always say, I talked to this provider and that provider. And they said, I don't like this insurance company. I don't like that insurance company. I guarantee you, if I lined up 100 different providers' offices that had no knowledge of this survey and talked to them all separately, and I asked them which insurance company is the hardest for you to deal with, they'd all give me a different answer. They'd probably mention every insurance company known to man, I would hear, because I'd get a different answer from all of them. It all comes down to their personal biases, personal preferences, all that stuff, and everything else in between. The other big problem about this is why, let's kind of dissect why there is such a problem when it comes to billing. Why is it such an issue? Number one, I think the job is very difficult, especially for somebody that works in a provider's office that takes a multitude of different types of insurance. Medicare Advantage, ACA, group insurance. They all are billed a different way. They all have a different system. I actually do feel for those people. When I stop feeling bad for them, it's because they're trying to be experts on something they're not licensed in and they know nothing about. Insurance. And typically, 99% of the information they give is wrong or it's a half-truth. Giving someone the information, you should go on original Medicare and not mention anything else, is a half-truth. Yeah, you might get something approved easier with original Medicare. But if you have nothing else, you aren't going to be able to get a ton of things that you need. It could financially cripple you just having original Medicare. Horrible, awful information. A half-truth. No mention of a Medicare supplement. Even if they did mention the Medicare supplement, they probably wouldn't provide context. Medicare supplement in a lot of places in this country will cost you $150 to $250 a month in premium, not to mention the prescription drug plan you have to pick up on the side of it. A lot of people can't afford that. And for what? To avoid a Medicare Advantage plan that in many places of the country has a $2,000, $3,000, $4,000 a year max out of pocket with a $0 premium? There's a reason why Medicare Advantage is growing in this country. It's continuously getting better, the benefits are growing, and it's becoming harder and harder to justify the extra premiums of a Medicare supplement. Medicare supplements have a place, and they are very good plans, and you should look at both options when you're getting onto Medicare. 100%. But 5 to 10 years down the road, Medicare Advantage is the future. Managed care is the future. But providers don't like it because they have to do a few more steps to get the billing done. Doesn't mean it won't pay. It means that a few more steps need to be done to get the billing corrected. And oftentimes they're not willing to do it. And who suffers at the end? The patient. It should be illegal in the United States of America for a provider to give insurance advice without an insurance license or credentials or any knowledge of the insurance. It should be illegal. It'd be illegal for me to impersonate a doctor. If you came to me and I pretended to be a doctor and I gave you medical advice, I even tried to perform surgery on you, what would happen to me? I'd go to prison. These providers, these hospitals, these doctors that are taking it upon themselves, in my opinion, should be fined at the very least. Should be a punishment. Should be a penalty at the very least. There's a lot of it's Medicare Advantage is an easy target. I would estimate, and with our small sample size, it's very, congruent to what's normal. What we typically find with Medicare Advantage plans is someone signs up for a plan that wasn't best for them. Maybe it's one that didn't have their doctor in network. They go to their doctor's out of network. That's not the plan's fault, it's that the doctor wasn't checked. Or maybe the person that signed them up for the plan didn't check the doctor. Of course, the patient suffers, but it's still not the plan's fault. They have a provider network. You have to stay in network. Pre-authorizations. That's what your doctor's office's job is. Their billing department is to get those done. Now, don't get me wrong. Every type of insurance has sometimes where, the insurance will play hardball. I'm not saying it's 100% of the time, but I would say 90 to 95% of the time, it's something small and stupid that the provider could have avoided. Providers don't know much about insurance. Write it down if you're listening to this. They don't know much about insurance. They know a hair more, typically, than an average pedestrian. But they like to present themselves as they know everything. Watch out for this, because bad information could financially cripple you. Bad information could put you in a situation where you have original Medicare because your doctor's office told you to, and nothing else. You don't have a supplement. You don't have a drug plan. You don't have anything like that. And all of a sudden, you can't get on a drug plan because it's outside of open enrollment. Maybe you get prescribed a cancer medication that's $20,000 a month. You have no insurance. Thanks, doctor's office. Or maybe you have $200,000 or $300,000 or $400,000 worth of medical bills with an unlimited 20% out of pocket. Thanks, doctor's office. You advised original Medicare opposed to a Medicare Advantage plan where I have a cap and a max out of pocket and copays that limit my costs significantly. These are things you need to watch out for. Understand that everything has good and bad. Medicare supplement has good and bad. The good is the coverage is close to full coverage. You don't have any networks. You can go where you want to go. But the bad thing is you have to pay a much higher premium. The premiums continuously go up as you get older. You have to pick up multiple different plans. The good about Medicare Advantage is the premium's low. You have everything combined into one plan. It's simple. You have your prescription coverage, your dental, vision, hearing all together into one plan. The bad is you have networks. As long as you have somebody who's working with you, who is a qualified professional that knows what they're doing, to help you pick a plan, like my organization, for example, you will not have the same kind of problems. And you need somebody like my office that you can bring claims to when you run into them that can help you straighten them out. As I said, if we get 100 claims, probably 95 of them are something stupid like that. It's a billing problem with the provider that's easy to fix. But if we weren't around, do you think that person would be able to get it fixed? No, typically not. The consumer, the person on the plan, the beneficiary, would not know what to do. The provider's not going to help them, so they end up paying a big bill. I talked to someone the other day, has a Medicare Advantage plan with a $4,000 max out of pocket. She said 2 years ago on that plan, when it had still a $4,000 max out of pocket, she ended up paying a $10,000 bill because she thought she had to pay it. When we dug into it, it was too late to get anything fixed, and we weren't the agent on file. There's nothing we could do about it. But when we dug into it, it was an emergency room bill, and they never billed her insurance. That's wrong. She had a $4,000 max out of pocket. Her emergency room copay would have been $100. So she paid $10,000 when she should have paid $100. It's because the insurance never got the claim. They never received the claim. How can they pay for something that they never even know even happened? I'm not saying insurance companies are saints. I'm not saying insurance companies are perfect. They certainly aren't. But we need to have an honest conversation in this country when it comes to Medicare Advantage, health insurance, the billing system, and why things are as difficult as it is. And it's really not the insurance companies as much as you think it is. It's more a lot of providers that think they know what things they don't, and giving advice that they shouldn't, and not having a good working knowledge of billing or insurance. I actually have a friend who is a doctor, and he tells me the hardest position to hire for is billing. It's a revolving door. He typically can't keep anybody more than 2 or 3 months, and I've heard this sentiment before. What does that mean? It means that it's a hard position to keep people for. It's high stress. I understand that. I feel for those people. However, if you are bringing in a new person every 2 or 3 months that's starting from scratch, that knows nothing, they're learning as you go. How well can you know a complex job if you've only been doing it 2 or 3 months and you replace the person every 2 or 3 months? That, to me, is the biggest problem here. You don't have a lot of highly experienced people. People job flip. People hop from job to job. And who ends up suffering in the end? The consumer. There's more reason than ever to work with a great agent, good brokerage to kind of represent you and your plan, because a good agency can help get you out of those weeds. They can work on your behalf. They can help out with claims. And they can make sure that you're on the plan that's going to cover your doctors, that's going to cover your needs, and the right plan is chosen for you. Some people think they're better off doing it on their own. I'm here to tell you that picking the plan on your own is one of the dumbest things you can do. The absolute dumbest. Why? Because you can do as much online research as you want, 100 hours plus. You're never going to know what that licensed professional knows that's got 10 years in the business, like someone like me. You'll never know what I know. You haven't seen what I've seen. You don't have the experiences that I have. Make sure that you're working with someone that's unbiased, that works with a multitude of different insurance companies, that's not biased towards Medicare Advantage or Medicare Supplement. Work with somebody who is practical, and you will avoid a lot of these problems. But never take insurance advice from your provider. Just don't do it. You'll save yourself a world of trouble. Anyway, folks, if you enjoyed this episode of the Everything Medicare Podcast, please do me a favor. This is the annual election period. Please give us a 5-star review. It helps more people find this information who desperately need to hear it, who are in a world of hurt right now. If you'd like to work with my organization, we work with people in over 40 states. Our office number is 801-255-5340. Again, 801-255-5340. I am Christian Brindle of Christian Brindle Insurance Services, and we'll be back with another episode next time. Hope this was helpful and enlightening. Thanks, everybody. We'll see you next time.